Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to a new class of English for non-subject specialists for medical students at Tripoli University first semester. Today we are going to deal with two issues related to the job and the profession of medication. And number one, we are going to deal with administering medication, how to give medication, what kind of medications given to the patients, and how to control these medications. Also, how to describe, how to give the prescription and to describe the frequency of this medication. That means how to measure the time, how to measure the quantities of these medications. So today we are going to cover two issues, inshallah. In addition, we are going to talk about the future, how to talk about the future in English language. So welcome to the class, and let's start the class. As you can see here, we have in front of you, we have different types of medications. We have dosages, and there are different types of therapies, and some of them they come as injections, some like drugs or pills, and other like syrup and or ointment. So we have different types, and today we are going to deal with them. First of all, we are going to listen to the medical history medications, and then after that we are going to answer the questions as they come in order. Welcome to the class again, and let's start the listening.
Unit 13, Administering Medication. Exercise 5, page 29.
Patient, Catherine Gates. Medical history. Medications. 0512. Ms. Gates came in complaining of a rash. She received a topical ointment to administer to the affected area. 0517. Ms. Gates was admitted to the hospital with serious dehydration and breathing trouble. She was given fluids through an IV. She was also given a 200 mg dosage of steroids. The route of administration was an intramuscular injection, IM. 0519. Ms. Gates's persistent illness has been caused by an infection. Serious complications have arisen. Antibiotics are being given through subcutaneous injections and PR. 0526. Ms. Gates was discharged today. Her physician prescribed antibiotic pills to be taken for 2 weeks. These should be taken PO and can be swallowed or absorbed sublingually.
Okay, before we listen again, look at the questions true and false. Number one, Mrs. Gates was given fluids through an intramuscular injection. 2, Ms. Gates received antibiotics PO while in the hospital. And finally, number 3, Ms. Gates' antibiotic pills can be taken sublingually. Now let's listen again, and then we answer these questions true or false.
Unit 13, Administering Medication. Exercise 5, page 29.
Patient, Catherine Gates. Medical history. Medications. 0512. Ms. Gates came in complaining of a rash. She received a topical ointment to administer to the affected area. 0517. Ms. Gates was admitted to the hospital with serious dehydration and breathing trouble. She was given fluids through an IV. She was also given a 200 mg dosage of steroids. The route of administration was an intramuscular injection, IM. 0519. Ms. Gates's persistent illness has been caused by an infection. Serious complications have arisen. Antibiotics are being given through subcutaneous injections and PR. 0526. Ms. Gates was discharged today. Her physician prescribed antibiotic pills to be taken for 2 weeks. These should be taken PO and can be swallowed or absorbed sublingually.
Okay, so for question number 1, Miss Gates was given fluids through an intramuscular injection. That means, is that correct or incorrect? Is it true or false? You can write the answer if you know. So this is no. So the answer is false. Number 2, Miss Gates received antibiotics, PO, while in the hospital. Again, this is false too. She didn't receive any of these antibiotics. Number 3, Miss Gates' antibiotic pills can be taken sublingually. Yes, so this is true. This is true. Okay, now we move to the next exercise. So number 1 is false, number 2 is false, and number 3 is true. Now go to the next exercise, which is about match the words 1 to 6 with the definitions. So we have definitions A to F. So we have topical, sublingual, subcutaneous, and PRIV and PO. So number 1, topical. Topical goes with number F. So this is F. Yes, topical is applied to a certain part of the surface of the body. Sublingual is number C, given beneath the tongue. Sublingual. Subcutaneous, number 3 is A, injected into the fatty layer under the skin with a syringe. So this subcutaneous. Number 4, PR is D, taken through the rectum. IV, number 5, is E, injection into a injection into a vein using a syringe, often over a long period of time. Finally, PO is B. The PO is B, taken orally or through the mouth. So we have these 6 types of, we say, medication that patients have when they are sick, and they can take the pills or the therapy or the medicine through. Now we go to the vocabulary. Again, with the vocabulary, we have very important words in here. We have dosage, we have intramuscular injection, we have, yes, route of administration, and administer. So number one, is the, for this medicine, sublingual or PO? So is the, yes, route administration. So number 1 is route administration for this medicine, sublingual or PO. So number 1 is route of administration. Number 2, please get me a syringe so I can give this, yes, we say intramuscular injection. So number 2, please give me a syringe so I can give this, is, yes, intramuscular injection. 3, how should we, Mrs. Smith's medicine, how should we? Number 3, administer. So number 3 is administer. How should we administer Mr. Smith's medicine? For this patient, the correct number 4, for this patient, the correct dosage. So number 4 is dosage is 200 milligrams per day. For this patient, the correct dosage is 200 milligrams per day. Okay. Now we move to a conversation between a doctor and a nurse, and then we are going to choose the correct answers. Number 1, question number 1, what are the speakers mainly talking about? Differences between antibiotics and aspirin, how to perform an intramuscular injection. They talk about a mistake involving routes of administration, or what medications to give to 2 patients. So this is question number 1. Number 2, why should Mr. Brown be given aspirin sublingually? Because he can only have 600 milligrams per day, or he doesn't like to swallow pills, or he's afraid of getting injections, or he is unable to chew tablets. So we are going now to listen, and after that, we are going to answer the questions. Listen, please.
Exercises 6 and 7, page 29.
Cindy, let's review these patients' meds before I head out.
Sure thing, Doctor.
Ms. Fulton should receive 150 milligrams of antibiotics twice daily.
Should that be administered PO or through an injection?
An IM would work better. Second, Mr. Brown can have aspirin if he asks for it, but not more than 600 milligrams per day.
Okay, he'll want to take that sublingually, right?
Yes, he can't chew tablets.
Got it. Thanks, Doctor. Have a good night.
Okay, listen again.
Exercises 6 and 7, page 29.
Cindy, let's review these patients' meds before I head out.
Sure thing, Doctor.
Ms. Fulton should receive 150 milligrams of antibiotics twice daily.
Should that be administered PO or through an injection?
An IM would work better. Second, Mr. Brown can have aspirin if he asks for it, but not more than 600 milligrams per day.
Okay, he'll want to take that sublingually, right?
Yes, he can't chew tablets.
Got it. Thanks, Doctor. Have a good night.
Okay, so the right answer, what are the speakers mainly talking about? Number 1, A, B, C, or D. So they were talking about what medications to give to 2 patients. Okay, number 2, why should Mr. Brown be given aspirin sublingually? Because, again, he is unable to chew tablets. So the answer is D. So number 1 is D, and number 2 also is D. Now we go to the last part, which is to complete the conversation. We have, as usual, we have 6 questions. So we can listen and then fill the gaps with the suitable words. Listen and answer the questions.
Exercises 6 and 7, page 29.
Cindy, let's review these patients' meds before I head out.
Sure.
Okay, Cindy, let's review these patients' meds. Yes, before I head out. Before I head out. Number 2.
Sure thing, Doctor.
Ms. Fulton should receive 150 milligrams of antibiotics twice daily.
So, Ms. Fulton should receive 150 milligrams of antibiotics twice daily. Twice daily. Yes. And number one, sorry, we have before I head out. Before, yes. Okay, number 3.
Should that be administered PO or through an injection?
Yes. Should that? Should that be administered PO or through an injection?
An IM would work better. Second, Mr. Brown can have aspirin if he asks for it, but not more than 600 milligrams per day.
Yes. So an IM would work, better. Okay. Number 5.
Okay, he'll want to take that sublingually, right?
Yes. So talking about the future, he'll want to. So this is the future. He will. It means he will want to take that sublingually, right?
Yes, he can't chew tablets.
Got it. Thanks, Doctor. Have a good night.
Yes. He can't chew tablets. He can't chew tablets. Yes. So this is the conversation between, as you listened to a doctor and his nurse about administering the medications to their patients. Now, after we finish this administration, or we say medication administration, now we are going to move about and talk about how to measure the frequency, how to describe the frequency of these, we say, medications, as you see here. So we have here some frequencies talking about the medications. So, and these are the, we say, abbreviations: BID, TID, QHS, AC, PC, and QOD. So these are the BID, take twice per day, or take 3 times per day, or take at bedtime, or take before meals, or PC, take after meals. Finally, QOD is take every other day. So these are the, we say, the 6 types of frequencies given to, we say, to patients when they deal with medications. Now we are going to listen to this, we say, topic, and then after that we are going to answer the questions as they come in order. Listen, please, and then after that we are going to listen and check the answers.
Unit 14, Describing Frequency. Exercise 5, page 31. BID, take twice per day. TID, take 3 times per day. QHS, take at bedtime. AC, take before meals. PC, take after meals. QOD, take every other day.
Heartland Hospital, Ward 4F, Patient Medications. Bill Foster. Give Mr. Foster 200 milligrams of heart disease pills, TID. These should be taken PC with water. Jill Richards. Mrs. Richards can have ibuprofen, PRN. It should be taken AC though, so give her a snack with it. At night, she should also take her antibiotic pill QHS. Carrie Edmonds. Miss Edmonds needs steroid injections BID in the morning and night. Her IV drip should be exchanged QH. Alex Davis. Mr. Davis must have his injections frequently QID. If his heartbeat is irregular, give him a 25cc injection of lidocaine stat and notify the physician on call right away. Lucas Simpson. Mr. Simpson requires hydrocortisone QOD.
Okay, so these are the 6 types of timing and the frequency of medications. Let's listen again, and then we answer the true or false. So number 1, Mr. Foster should take his heart disease pills after eating. Number 2, Miss Edmonds needs steroid injections 3 times per day. And Mr. Davis has a condition that could require immediate attention. So let's listen and then answer these questions. Listen, please.
Unit 14, Describing Frequency. Exercise 5, page 31. BID, take twice per day. TID, take 3 times per day. QHS, take at bedtime. AC, take before meals. PC, take after meals. QOD, take every other day.
Heartland Hospital, Ward 4F, Patient Medications. Bill Foster. Give Mr. Foster 200 milligrams of heart disease pills TID. These should be taken PC with water. Jill Richards. Mrs. Richards can have ibuprofen PRN. It should be taken AC though, so give her a snack with it. At night, she should also take her antibiotic pill QHS. Carrie Edmonds. Miss Edmonds needs steroid injections BID in the morning and night. Her IV drip should be exchanged QH. Alex Davis. Mr. Davis must have his injections frequently QID. If his heartbeat is irregular, give him a 25cc injection of lidocaine stat and notify the physician on call right away. Lucas Simpson. Mr. Simpson requires hydrocortisone QOD.
Okay, so for question 1, Mr. Foster should take his heart disease pills after eating. So is that true or false? So this is true. Yes, he should take his heart disease pills after eating. Mr. Edmonds needs steroid injections 3 times per day. This is untrue, so this is false. No, not 3 times. Yes, and number 3, Mr. Davis has a condition that could require immediate attention. Yes, this is true. Yes. Yes, his condition needs an immediate attention. Now for the definitions, we have QID, QOD, PRN, BID, TID, and QH. Number 1 is E, is given 4 times per day, QID. Yes, QOD is number B, given every other day, QID. PRN, number 3 is D. Number 3 is D, given as needed. Number 4, BID. BID is number C, given twice per day, and TID is number A, given 3 times per day, and finally is QH is number F, which is given every hour. QH, yes. Yes, QH. So given. Now we move to the next. And this lesson or this exercise, we have to write a word that is similar in meaning to the underlying part. So we are giving synonyms. Synonyms, that means the same meaning. So we write a word that gives the same meaning of the word given in here. So number one is I need 50 cc's of lidocaine immediately. So immediately is the word stat. Stat. You should take this antibiotic when you go to bed. Go to bed is QHS. QHS. The patient should take this medication before he eats. Before he eats. So this is QC. Sorry, it's AC. I said QC. It is AC. Sorry. Before AC. And you will need to take a pill once every hour until you start to feel better. So once every hour, it is a QH. And number five, yes. Number 5, take 2 of these after you eat. Yes, what's the answer? Anyone can give me the answer? Yes? Can you give me the answer? It is QH. It is PC. So it means after, means PC. And we have before, which is AC. So this is before AC, where after and after is PC. Like when we say AM, PM. AM in the morning, PM in the afternoon or in the evening. So before and after. A means before, where P means after. So AC, PC. Okay. Now we move to the next exercise. Now we are going to listen to a medication list for patients again. How often the patients need the administration or their medications. And this conversation is between a doctor and the nurse, and we are going to choose the correct answers. Listen, please, and then answer questions 1 and 2. When should the patient have his antiviral pills? A, before meals, B, after meals, C, at bedtime, or D, in the morning. Number 2, how often can the patient take, we say ibuprofen, twice per day, 3 times per day, before any meal, or as often as needed. So listen, please, and then we answer questions 1 and 2.
Exercises 6 and 7, page 31.
Sharon, Mr. Walker is a new patient. Let's review his meds.
OK, doctor. What does he need?
He needs a 150 milligram dosage of these antiviral pills.
Sure. And how often should he get those?
They should be taken TID, preferably AC, before they bring his food.
I understand. Anything else?
He can also have 2 tablets of ibuprofen PRN for his pain, but not more than 800 milligrams per day.
Got it. I'll add it to his chart.
Okay, listen again.
Exercises 6 and 7, page 31.
Sharon, Mr. Walker is a new patient. Let's review his meds.
OK, doctor. What does he need?
He needs a 150 milligram dosage of these antiviral pills.
Sure. And how often should he get those?
They should be taken TID, preferably AC, before they bring his food.
I understand. Anything else?
He can also have 2 tablets of ibuprofen PRN for his pain, but not more than 800 milligrams per day.
Got it. I'll add it to his chart.
Okay, so number 1, when should the patient have his antiviral pills? So he said before having meals, or before he has his food, so that's before meals. How often can the patient take the ibuprofen or ibuprofen? So this is as needed, as often as he needed this. Okay, the last part of this lesson is, as usual, we fill the gaps of 6 gaps, 6 missing words. And yes, try to write down the missing words.
Exercises 6 and 7, page 31.
Sharon, Mr. Walker is a new patient. Let's review his meds.
OK, doctor. What does he need?
He needs
Okay, doctor. Okay, doctor. What does he need? What does he need?
a 150 milligram dosage of these antiviral pills.
Of these antiviral pills. Antiviral pills.
Sure. And how often should he get those?
And how often? Should he get those?
They should be taken TID, preferably AC, before they bring his food.
So they should be taken. They should be taken. TID, preferably PC, before they bring his food. 5.
I understand. Anything else?
Anything else? Anything else?
He can also have 2 tablets of ibuprofen PRN for his pain, but not more than 800 milligrams per day.
Got it. I'll add it to his chart.
Yes, but not more than. Not more than. Yes. 800 milligram per day. Okay. So as you watched today. So we talked about, today we talked about two issues. We talked about the dosages or the kinds of medications, and of course the frequency or the time needed for these medications. Okay, and of course the importance of giving these medications on time to guarantee, we say, results. Now we are going to move to the last part of this class. As usual, we are going to deal with language issues, and today we are going to deal with, or finishing, the topic of the future. And the topic of future, we talked a lot about it, and now we are going to deal with how to talk about the future using the present simple tense. هنتكلم عن الكلام عن المضارع أو استخدام المضارع البسيط في الدلالة على المستقبل. طبعا احنا أخذنا باستخدام في الحصص الماضية استخدام will واستخدام going to Okay, sorry for this interruption. Anyway, so we talked about using the future by will. أخذنا will وأخذنا going to وأخذنا ing. اليوم راح نأخذ استخدام المضارع البسيط اللي هو مضارع بسيط يتكلم عن الحقائق والفاكتس اللي هو كان الحصة رقم 1 في هذه السلسلة. How to use this and to talk about the future. We can use the present. We can use the present simple. Talk about the future events that are part of, we say, official arrangements. كما موجود هنا في الكتاب مكتوب official arrangements. الأشياء التي هي روتين، جزء من الروتين اللي هي يعني تم من الofficial، من الترتيبات الرسمية، شيء رسمي. مثلا المواعيد، مواعيد امتحانات، مواعيد الدراسة، مواعيد العطل، مواعيد يعني لو واحد عنده مثلا إصدار بطاقة أو كذا، موعد إصدار جواز، فهناك مواعيد، فهذه تعتبر official arrangements. عيادة تفتح من كذا تسكر في كذا، فهذه مواعيد محددة. Their plane arrives at 2 o'clock in the morning. هنا their plane، هنا يتكلم عن شخص أو يتكلم عن الطائرة. Their plane arrives at 2 o'clock in the morning. أي الطائرة تصل الساعة 2 صباحا. الطائرة لم تصل لحد الآن، لكن لأنها جدول ولأنه مواعيد طيران فمش نقول the plane is going to arrive or the plane will arrive or the plane is arriving. لا نحتاج إلى هذه التعقيدات، لأنه ما زال هذا الشيء هو عبارة عن time، وقت محدد، فحنحتاج فقط المضارع البسيط لأنه جزء من حركة الطائرات واللي هي كلها محددة بأوقات. The next meeting of the committee is on November 5th. إذا هنا the next meeting، إذا هنا نتكلم عن اجتماع مبرمج، اجتماع للجنة is on November 5th. يعني ممكن نقول on is going the meeting is on January the 10th، 10 من شهر 1 القادم. يعني لسه احنا لشهر 1 في شهر 12، لكن لأنه هذا الموعد ممكن كل أسبوعين، ممكن كل أسبوع، ممكن كل شهر، لأنه محدد فنستخدم منقول المضارع البسيط اللي هو is. أما في اللي قبلها فكانت arrives. We get off the train in Bristol and continue by bus. We get off the train in Bristol and continue by bus. إذن هم لحد الآن لم يذهبوا إلى بريستول، لكن عندما نصل إلى بريستول سننزل من القطار ثم نكمل الرحلة بالباص. يعني يتكلمون عن المستقبل، لكن لأنه هذا خط قطار وخط باص شيء محدد، يعني ما نقدر احنا نغيره سير القطار أو مواعيده، فنستخدم المضارع البسيط. I'm away on holiday next week.
can we meet the week after? Can we meet the week after? إذن I'm away on holiday. أنا الآن في إجازة. Can we meet the week after? ممكن نلتقي الأسبوع القادم. هنا أيضا يعطي تعليمات. We often use will and infinitive in sentences like these with little difference in meaning, although the present simple suggests that the arrangement is fixed and definite. إذن ممكن نستخدم مرات will بدل المضارع، لكن استخدام المضارع التام يعطي معنى أنه الارينجمنت الترتيب is fixed and definite، أي الترتيب أو الموعد هو ثابت لا يتغير ويعني نهائي خلاص definite مؤكد. We don't use the present simple when we talk about personal plans or predictions. إذن هذه الأشياء التي خاصة بالحاجات الشخصية اللي هي personal plans، يعني حاجة شخصية، يعني لا يوجد تايم تيبل، لا يوجد يعني شيء محدد، مثلا حركة قطار، وصول طائرة، حركة طائرات، مواعيد مراجعة في مثلا مكاتب رسمية، لا، أشياء خاصة لا، أو للتنبؤات لا نستخدم المضارع البسيط، بل نستخدم الذي استخدمناه المواضيع في الحصص الماضية اللي هي will going to or the present continuous. مثلا I'm really exhausted. I'm just staying in to watch TV tonight. إذن هو يتكلم عن نفسه، يعني حصلت له حاجة أنه هو تعب أو يشعر بالتعب فسيبقى في البيت ويشاهد التلفاز. إذن هنا لا نحتاج المضارع بل نحتاج استخدام المضارع المستمر. I'm staying هنا not I just stay. لا نستخدم المضارع البسيط هنا. Although it is a problem only in Britain at the moment, I think it will affect the rest of Europe soon. إذن يتكلم على مشكلة لكنها سوف تؤثر على مستوى أوروبا. The rest of Europe it will affect. لماذا؟ لهذا رأيي الشخصي، رأيي الشخصي، ليس هناك موعد ولا يوجد تحديد مواعيد. However, we prefer the present simple if we can make a definite specific prediction, because an activity or event is part of an official arrangements such as timetable or a program. ممكن نرجع مرة ثانية المضارع البسيط إذا كان هذا جزء من برنامج عام، جزء من برنامج محدد أصلاً ومثبت بتواريخ ومواعيد، هنا نلزم باستخدام المضارع البسيط. مثلاً There is a full moon tonight. عندما يصبح القمر 14 أو الليلة 14 من الشهر القمري يصبح عندنا قمر بدر. هذا شيء محدد، مش أنا يعني مش إحنا لن ندخل فيه، لكن هو كل 14 الليلة 14 من الشهر يصبح القمر بدراً. فإذا there is a full moon هنا محدد بالشيء. إذا كل شهر في يوم 14 من ليلة هذا الشهر يصبح القمر بدراً، يعني شيء محدد إلهي مرتب ترتيب لا نستطيع أن نتحكم به. The sun rises تشرق الشمس at 5:16 tomorrow. تشرق yes. يعني مثلا احنا عندنا الشمس تشرق اليوم. The sun rises 7:58 يعني tomorrow إن شاء الله the sun rises at 7:58 يعني ستشرق الشمس. الشروق عندنا في طرابلس الساعة 7:58. لا نضع احنا هذا الكلام، لكن هو محدد بشكل يعني دقيق، وهو شروق الشمس لا نتحكم بشروقها أو غروبها. إذن في C we use the present simple to refer the future not will in adverbial clauses، في العبارات الظرفية التي تستخدم فيها الوقت اللي هي مثلا after before when إلى آخره. After you go another 50 meters you will see a path to your left. After you go another 50 meters بعد ما تقطع 50 متر you will see ستشاهد a path of your left to your left، ستشاهد طريق على يسارك. إذا هنا لأنه هناك ترتيب زماني after و before إلى آخره. When you see Dennis, tell him he still owes me some money. إذن عندما تشوف دينيس، إذا شفته قول له إنه هو يطلبني بعض he still owes me some money. Okay. Wait here until I call you. Wait here. Wait. انتظر فعل أمر. Until حتى I call you. Not until I will call you. لا. Wait until I call. لاحظوا هنا الاستخدام كأنه أفعال أمر وتوجيهات، إعطاء directions، فلا نحتاج إلى تعقيد هذا الكلام. مجرد ذكر الزمان after, before, until, when. نستخدم المضارع البسيط لاختصار التعقيد واختصار الجمل الطويلة. Let me know if he says anything interesting. إذن هنا حنستخدم معها أيضا المضارع البسيط مع if, conditionals unless when and provided في حال توفر الشيء. Let me know if he says anything interesting. Provided the right software is available, I should be able to solve the problem. Provided the right software يعني في حال، فكلمة افتراضا نفترض إذا السوفت وير موجود، السوفت وير صحيح، إذن the right software is available. نفترض في حال وجود السوفت وير الصحيح I should be able to solve the problem. في حال توفر العدة المناسبة أستطيع أن أحل المشكلة. I'll bring a compass in case we get lost. I'll bring a compass in case we get lost. سأجلب معي بوصلة في حال إنه we get lost، في حال إنه تهنا أو ضيعنا الطريق. فلاحظوا إذن هنا استخدام المضارع يتكلم هنا على أشياء محددة بالضبط تحصل للناس أو تحصل للمتكلم من أجل إعطاء المعنى بشكل مختصر. We use the present simple in that and WH clauses when both the main clause and the that WH clause refer to the future. هنا نستخدم relative clauses اللي هي الجمل المركبة. I'm going to make sure that you are invited next time. The main clause اللي هي العبارة الرئيسية. I'm going to make sure، سأتأكد ماذا؟ that you are invited next time. حتأكد إنه I'm going to make sure. إذن هذه المين العبارة الرئيسية، وهذه that المساندة يسمى المساندة that you are invited next time. Not you will be invited. هكذا اللغة. Let me know when she gets here. I'll let you know. I'll let you know, or حتى let me know, or I'll let you know when she gets here. سأبلغك عندما تصل هنا. When she gets. فلاحظوا هنا نتكلم برضو على شيء له علاقة بالزمن. That you are invited next time. نتكلم عن بعد زمني محدد هنا بهذا الشكل. When the main clause refers to the present, we normally use will, not the present simple, in that WH clause. However, if we are talking about a fixed arrangement, we can use either will or the present simple. لاحظوا هنا المقارنة ما بين الجملتين. حنشرح الفرق بدل ما نقرأ في القواعد، نشرح الفرق في الجملة في المعنى. I guarantee that you will enjoy the play. I guarantee هنا استخدم I guarantee هنا that you will enjoy. It is fortunate that they arrive at the same time tomorrow. إذن I guarantee that you will enjoy. عندما استخدم هنا اللي هو when we use main clause refers to the present. إذن guarantee معناه هنا يتكلم عن هذا الوقت حنستخدم will. لكن في الثانية إذا كنا نتكلم عن شيء محدد we can use will or the present حسب المعنى. يعني إذا كان هناك شيء يتكلم عن المضارع هنستخدم will. I guarantee أي أؤكد لك الآن that you will enjoy the play. It is fortunate that they arrive at the same time tomorrow. إذا هنا fortunate معناها من الحظ أو من الصدفة. إذا لا يتكلم عن الآن، يتكلم عن المستقبل، فممكن نستخدم المضارع البسيط أو ممكن نستخدم will أيضا. يعني فلاحظوا التحديد، مضارع لازم نستخدم مع will، أما غير محدد لا، فنستخدم مضارع أو استخدام will حسب الحاجة. هذا كله يتأتى بالاستماع. ليست خطأ استخدام will، لكن نحن نستخدم الأصح. The better usage of making the future. كل أنواع الفيوتشر اللي أخذتوها سابقا هي صحيحة. استخدامكم حيكون مرة صحيح مرة خاطئ إلى أن تتعود على المعنى المطلوب من خلال المعنى ومن خلال الاستخدام اللغوي الذي يستخدموه الناطقين باللغة الإنجليزية. تستطيع أن تطور أدائك أنت. لا نجتهد إحنا، لا نخترع قواعد من عندنا، لكن نستمع ثم نقوم باستخدام اللغة كما سمعناها. Okay, now we go to the exercises. حننطلق إلى التمارين. Okay. Number 1. If possible, use the present simple of an appropriate verb to complete these sentences. If the present simple is not correct, use will plus infinitive. إذا كان مضارع ممكن حسب المعنى نستخدمه أو نستخدم will زائدا فعل. Alice is a new play at the Grand Theatre next week. فنتكلم هنا إذا نتكلم عن Alice's new play. Play طبعا هنا معناها مسرحية. معناها في مسرح وفي موعد. و at the Grand Theatre next week. إذا هناك على المسرح الكبير. فإذا حنستخدم الفعل اللي هو حنقول opens. ستفتتح. أو ممكن نقول starts at the Grand Theatre next week. إذا هنا opens يفتتح. ليش opens؟ لأنها عبارة عن مسرحية، والمسرحية فيها مواعيد عرض وبداية ونهاية. With more practice, she an excellent violinist. إذا with more practice مع تدريب أكثر an excellent violinist حتكون عازفة كمان ممتازة. طبعا هذا رأيي الشخصي، معناه هنا هذا شخص يعطي his opinion، يعني هو يتوقع هذا الشيء. إذا ما زال هو رأي شخصي فحنقول will become، حتصبح she will become. حنستخدم ال will. لماذا؟ لأنه it's a personal opinion، رأي شخصي. National No Smoking Week، أي الأسبوع عدم التدخين. فكلمة national معناها أسبوع وطني لعدم التدخين. On October the 24th، سيبدأ في يوم 24 من شهر 10. إذا باعتبار أنه هذا الشيء محدد مسبقا راح يكون ماذا؟ هنا حنقول starts. لماذا؟ لأنه هذا موعد لمناسبة وطنية، فهذه لا نستطيع تحديدها نحن، بل هي محددة مسبقا. On tonight's program, we to the Deputy President about the latest unemployment figures. On tonight's program في برنامج الليلة we to the Deputy President نستمع إلى نائب الرئيس about the latest unemployment figures اللي تتكلم عن أرقام عدم أو الأرقام البطالة أو عدم العمل. إذا number 4 we talk، ممكن حنقول we talk نتحدث، أو ممكن هنا نستخدم will talk also is possible. الحالتين ممكنة إنه نستخدم. ليش؟ لأنه tonight's program معناها نتكلم عن time محدد، وقت برنامج مسائي معناه وقت محدد نقدر نقول talk، أو باعتباره opinion شخصي نستخدم will زائدا فعل. فالحلين ممكنين. In a few moments, number 5, in a few moments, I over there and give the signal to start running. إذا شخص يتكلم عن نفسه in a few moments في بعد عدة لحظات I'll walk سأمشي حيتكلم عن نفسه over there and give the signal to start the running وأعطي الإشارة لبدء السباق. باعتبار شيء هو يحدده يمشي يبدأ أو ينتهي بالمشي أو عدم المشي فيستخدم will. لماذا؟ لأن هنا personal. The eclipse at 3 minutes past midday. Eclipse. طبعا كلمة eclipse هي معناها في اللغة العربية الخسوف أو الكسوف. فكلمة lunar eclipse أي خسوف القمر، وسونر eclipse معناه كسوف الشمس. فإحنا بالعربية عندنا كلمة كسوف وخسوف، في الإنجليزية كلمة واحدة eclipse هي تيجي على القمر وتسمى lunar eclipse معناها عندنا خسوف بالعربية خسوف القمر، وسونر eclipse اللي هي كسوف الشمس. The eclipse اللي هو الخسوف أو الكسوف at 3 minutes past midday محدد بوقت، هذا لسنا نحدده، هذا شيء فلكي محدد من الله سبحانه وتعالى. إذن ماذا سيكون نمبر 6؟ حيكون begins مضارع بسيط. begins نقدر نقول begins أو ممكن نقوله حتى starts. يبدأ begins at 3 minutes past midday بعد 3 دقائق بالمنتصف النهار. Number 7, Dr. Brown available again at 9 tomorrow. إذا دكتور براون باعتبار هنا موعد عيادة راح نقول هنا في نقطة دكتور براون is available again at 9 tomorrow. The door in front of us automatically in a few moments. The door in front of us أمامنا الباب الذي أمامنا automatically in a few moments حيفتح أوتوماتيكيا في عدة لحظات. فحنقدر هنا باعتبار نتكلم عن إحنا رأينا واقفين نتفرج حنقول will open سوف يفتح automatically. We Amsterdam on Tuesday morning but we Sydney until Thursday evening. We Amsterdam on Tuesday morning يتكلم عن مواعيد الوصول إلى أمستردام but we Sydney until Thursday evening ونصل إلى سيدني مساء الخميس. إذن سنصل إلى أمستردام يوم صباح الثلاثاء ونصل إلى سيدني مساء الخميس. إذن number 9 we leave نغادر أمستردام on Tuesday فإذا يسافرون لأستراليا في صباح الثلاثاء but we هنا arrive Sydney، لكن باعتبار هنا استخدم but لازم بعدها negative، لازم يكون في negative but we don't yes reach okay we don't reach Sydney until Thursday evening. سنغادر مدينة أمستردام في صباح الثلاثاء لكن لن نصل سيدني حتى مساء الخميس لأنه البط تستخدم نيجاتيف. لكن لو قلنا and بدل and we reach ممكن هنا لأنه and reach Sydney ما فيش until حتكون Thursday evening and reach Sydney Thursday evening بهذا الشكل. لكن لأنه في بط فلازم بعد البط يأتي negative نفي. Number 10 هذا الأستاذ أو البروفيسور. I to the main point of my talk in a little while. I يتكلم عن نفسه. I will come. I will talk. I will point to the main point. إذن I will come سأتي وأوضح to the main point of my talk in a little while. ليش I will هنا؟ لأن هنا personal view or opinion بهذا الشكل. باعتباره يتكلم فلا يستخدم المضارع البسيط I come. لا, I will come to the main point of my talk in a little while. Okay. سننتقل إلى 13.3 السؤال الأخير. حنختار الإجابة الصحيحة أو التي هي أصح أو التي هي أفضل كإجابة. فحنجي إلى رقم 1. Tonight I'm going to check that Susan does or will do her homework correctly. Tonight I'm going. باستخدام tonight معناها time or fixed time. I'm going to check that Susan does her homework correctly. إذن does هنا هو الإجابة الصحيحة. By the time the book is published next year, no one will be interested in that scandalous claims it makes or it will make. إذن by the time the book is published next year. إذن بوقت طباعة الكتاب في العام القادم no one will be interested in what scandalous claims it makes. إذن هنا راح تكون it makes. لا أحد يهتم بالادعاءات الفضائح لأنه حتصبح كلام قديم. حيصبح كلام قديم لا أحد يهتم به فهنا مضارع بسيط. Some people believe that the earth is destroyed, will be destroyed by a nuclear accident. Some people believe. إذن باعتبار opinion هنا number 3 people believe معنى هذا رأي يخص الناس that the earth will be destroyed. ستدمر الأرض بواسطة انفجار أو حادث نووي. إذن باعتبار رأي opinion راح نستخدم will plus verb. The new regulations mean that businesses will have to complete the form by the 1st of April. The new regulations. إذا هناك توجيهات أو توجهات جديدة that the businesses will have to. إذا قلنا have to فعندي time هو المهم. will have to معناها الopinion الرأي هو المهم والاثنين صحيحة. يعني ممكن نستخدم have to إذا كان الوقت والتوقيت هو المهم. إذا كان الرأي هو المهم حنستخدم will have. So both are correct. have to صحيحة و will have to برضو صحيحة. Jim just phoned. He says that he'll be with us tonight. إذن Jim just قبل شوي اتصل بالتليفون باعتبار تكلم كشخص كجيم that he will be or he'll be with us tonight. ممكن نقول he'll أو he will be with us tonight. إذن ليست باستخدام is. It says in the program that the concert will finish at 10:20. It says in the program. طبعا هنا الجدول أو مواعيد الحفلة الموسيقية معناه إلها بداية محددة ونهاية محددة. إذا it says in the program the concert finishes at 12:20. إذا يفضل الحل الأول. طبعا will finish ممكن أيضا تأتي لكن أنا رأيي الشخصي إنه finishes باعتبار أنه تايم تيبل، أي مواعيد، يعني الحفلات الموسيقية، السيمفونيات كذا لها وقت بداية ونهاية. سينما وقت العرض يبدأ كذا ينتهي كذا. زيارة في المستشفى تبدأ الزيارة من الساعة 3 إلى الساعة 4. أوقات محددة مش على مزاج الشخص، لكن هناك برنامج موضوع مسبقا ومحدد، فنستخدم المضارع البسيط. إذن إلى هنا تنتهي حصة اليوم. أتمنى أن نكون تعلمنا شيء، وإن شاء الله بالتطبيق بالاستماع المستمر حنكون نستطيع أن نكمل أو نستطيع أن نتقن اللغة بالاستماع والقراءة. لا يتم إتقان اللغة إلا بالاستماع، وهذا الشيء يجب أن يكون مخصص لكم وقت كل يوم. احنا قلنا 20 to 30 minutes every day for listening. إذا خصصتوا وقت للاستماع 20-30 دقيقة، صدقوني حتنحل مشكلة اللغة في وقت بسيط جدا، وتستطيعون أن تفرغون أو تتفرغون وقتكم الآخر إلى الدراسة الفعلية في كلية الطب. أتمنى لكم النجاح والموفقية، وإن شاء الله الحصة القادمة سنكمل المنهاج إن شاء الله، وراح نتكلم أيضا على التفاصيل التي تخص الامتحان بعد نهاية المنهاج. بعد ما نكمل الحصة القادمة حيكون هناك عرض لتعليمات اللي تخص الامتحانات وكيفية تقسيمها وإلى آخره، لكن حتكون هناك في الحصة الأخيرة إن شاء الله. لذلك الوقت نلقاكم على خير ومع السلامة.